Hello, I'm Emma Hammett, the founder and CEO of First Aid for Life and onlinefirstaid.com, and the author of Burns, Falls and Emergency Calls, the ultimate guide to the prevention and treatment of childhood accidents. Today, I'm going to talk to you about diabetes. Diabetes is incredibly common and it's getting more prevalent in the population as well. As people are living longer and as people are getting bigger generally, then there is more diabetes around. There are different types of diabetes. There's type 1 and type 2. I'm not going to go into those today, but generally type 1 people tend to get from birth, although this is changing as well. And type 2 is the one that is more linked to age and to size. But again, there are exceptions to all those, but diabetes is common and diabetes is incredibly serious. And it's really important that anyone who is diabetic looks after themselves particularly well, that they monitor their blood glucose and they keep it at normal levels, or as normal as they possibly can, in order to prevent long-term complications, which can be pretty major. And anyone that has diabetes will be well aware of these. From a first aid perspective, the most common emergency that you might need to help with is a hypo, when their blood glucose drops. So diabetes is a condition when someone is unable to adequately regulate their blood glucose levels. The body produces insulin, which is a hormone which helps you burn off your sugars. And if someone has problems with insulin production, either they're not producing it or they're not producing enough, or there may be something wrong with the insulin to mean that it doesn't work as it should, that causes them to develop diabetes. So diabetes can cause your blood sugar to drop, or it can cause your blood sugar to rise. And when it's initially diagnosed, what tends to happen is that people, you might find a child is drinking an awful lot, they're peeing an awful lot, they're tired, they're feeling rotten. Get them checked out, and that could be the early signs of hyperglycemia building up, and people talk about glucose intolerance as well. So that could be some early signs. It needs to be checked out early. In terms of treating someone for a first aid perspective for high blood sugar, you really need a medical professional quite quickly to help them and sort that out. The most common emergency, diabetic emergency, that you as a first aider are likely to see is a hypo. So it may be that someone who's diabetic has skipped breakfast and they've dashed to work because they woke up late and they just missed the bus and they ran for it, and they arrive into work or a child into school and they're not looking their normal selves. They might be behaving unusually, they might appear slightly drunk, they might be a little bit aggressive, a bit grumpy, pale, cold, a little bit shaky, sweaty, shallow, rapid breathing, a strong pulse, and they hopefully will be able to recognise the signs for themselves that their blood sugar has dropped. However, sometimes they may not actually recognise that that is the issue. If you have done extra activity without balancing it with a food intake, then you will be burning off your glucose faster than you can replace it. And in someone that hasn't got diabetes, we compensate. We've all had that feeling where just before lunch you might feel a little bit grumpy and a little bit shaky. But for a diabetic, it's far more extreme. And if they don't get some food quickly, it could be fatal. Unlikely in a small hypo attack, but in the long term, if they're not given some sort of sugary drink, or they don't recognise, particularly in the elderly, or in a young child that doesn't realise the importance of this, then it could be very serious. So if somebody is showing those signs and that person is diabetic, then encourage them to have a sugary drink. Something like Lucozade, not any of the diet drinks, but an original Lucozade or a non-diet Coke or something would be very good for boosting your blood sugar. Some sugar in water, dissolved in some water, can be helpful, or hopefully they will have some dextrose tablets with them that they can take, which will give them a quick sugar hit. Now, if they start to feel better, that is great. It needs to be followed up, so the food needs to be followed up with a more solid carbohydrate that was a more slow burning energy. So if they have had their initial sugary drink, you would then follow that up with some biscuits or a jam sandwich is a really good thing to follow up. So something that will actually sustain that sugar for a little bit longer. If they don't feel better within 10 minutes or they begin to get worse, you should phone the emergency services. And you should also encourage them, when they do feel better, to contact their diabetic nurse specialist to get some additional advice, particularly if they're having regular hypos. I mean, it is fairly usual for diabetics to have hypos because it's harder for them to regulate their sugar. But if it's happening on a very regular basis, then they need to speak to their diabetic nurse specialist to get help with the control of their diabetes. So if they start to feel better, that's great. Follow it up with a carbohydrate. If it was at night, so if it was a child, for example, or an elderly person, or someone who had hypo just before bedtime, before they'd normally go to bed, it's important to follow it up with a carbohydrate, to follow up the sugary drink with a carbohydrate. But it's also important to monitor and keep an eye on them, because while they're asleep, they could continue to burn that sugar off, and then they could go into a hypo overnight. So I would always encourage someone to speak to their diabetic nurse specialist if they've had a hypo late at night, and severe hypo, and get additional advice before they go to sleep. Never give an unconscious casualty anything to eat or drink. It sounds really obvious, but unfortunately it's quite common that people try and post a drink or post something sugary into them. If they're unconscious, that is dangerous. Phone an ambulance. And also, never be tempted to rummage in a diabetic's bag and give them an injection you might find, because the chances are that injection is insulin. And if you give insulin to someone who has low blood sugar, you will further lower their blood sugar, and that could prove fatal. So please never give somebody else's medication if they're diabetic. So really important to get additional help and advice, for them to speak to their diabetic nurse specialist, and for them to be managing and understanding their diabetes too. There's plenty of help out there, and there's lots of support for parents and relatives and work colleagues of someone who's diabetic, and also for the diabetic person themselves. I hope that's been useful. That's Emma Hammett from First Aid for Life.